Hello students, welcome back to our channel. In today's video, we are going to discuss about the 100 important physiotherapy question and answers that are very useful for the students, interns, competitive exam preparators, and also for the interviewees. So stay tuned. The first section is about anatomy and physiology. Number one, what is physiotherapy? Physiotherapy is a healthcare profession that restores movement, function, and quality of life through physical interventions. Number two, how many bones are in the adult human body? And the answer is 206 bones. What is the largest bone in the body? Femur. What is the smallest bone in the body? Stapes, middle ear. Question number 5. Which muscle is known as the strongest muscle? Masseter. Number 6. What is the largest organ of the body? Skin. Number 7. What is the functional unit of the nervous system? Neuron. Number 8. How many cervical vertebrae are present? And the answer is 7. Number 9. What is the normal resting rate, heart rate in adult? And the answer is 60 to 100 bpm, beats per minute. Question number 10. What is the normal respiratory rate in the adults? And the answer is 12 to 20 breaths per minute. Now let's move on to the second section, biomechanics. What is a lever? A rigid bar rotating around a fixed point, that is a fulcrum. Number 12. What are the three classes of levers? First, second, and third class lever. Question number 13. Which class of lever is most common in the human body? Third class lever. What is the center of gravity? The point where body weight is evenly distributed. Question number 15. What is equilibrium? A state where forces acting on a body are balanced. What is torque? Rotational force around an axis. What is kinetic chain? A series of interconnected joints and segments working together. Question number 18. What is open kinetic chain exercise? Distal segments move freely. Question number 19. What is closed kinetic chain exercise? Distal segment is fixed. Define posture. Alignment of the body part in relation to each other. Now, let's move on to the third section of this round, exercise therapy. 21. What is ROM? Range of motion. 22. Types of ROM exercise: active, passive, active assisted. Question number 23. What is stretching? Lengthening of muscles and soft tissues. Question number 24. What is strengthening exercise? Exercise that increase muscle force production. Question number 25. What is isometric exercise? Muscle contracts without changing length. Question number 26. What is isotonic exercise? Muscle changes length during contraction. Question number 27. What is isokinetic exercise? Exercise performed at constant speed. 28. What is aerobic exercise? Exercise using oxygen for energy production. 29. What is anaerobic exercise? High intensity exercise without sufficient oxygen. 30. What is endurance? Ability to sustain activity over time. And let's move on to the fourth section, electrotherapy. What is TENS? Transcutaneous electrical nerve stimulation. 32. Main use of TENS: pain relief. 33. What is IFT? Interferential therapy. 34. What is ultrasound therapy? Use of sound waves for therapeutic effects. 35. Frequency of therapeutic ultrasound: 1 MHz and 3 MHz. 36. What is SWD? Shortwave diathermy. 37. What is cryotherapy? Therapeutic use of cold. 38. What is thermotherapy? Therapeutic use of heat. 39. What is NIMS? Neuromuscular electrical nerve stimulation. Number 40. What is laser therapy? Use of light energy for healing and pain relief. Let's move on to the next section, orthopedic physiotherapy. 41. What is osteoarthritis? Degenerative joint disease. 42. What is rheumatoid arthritis? Autoimmune inflammatory joint disease. 43. What is frozen shoulder? Adhesive capsulitis causing pain and stiffness. 44. What is tennis elbow? Lateral epicondylitis. 45. What is golfer's elbow? Medial epicondylitis. What is scoliosis? Lateral curvature of the spine. What is kyphosis? Excessive thoracic curvature. What is lordosis? Excessive lumbar curvature. What is a sprain? Ligament injury. What is a strain? Muscle or tendon injury. And the next section is about the neurological physiotherapy. 51. What is stroke? Sudden interruption of blood supply to the brain. 52. What is hemiplegia? Paralysis of one side of the body. 53. What is paraplegia? Paralysis of both lower limbs. 54. What is quadriplegia? Paralysis of all four limbs. 55. What is Parkinson's disease? Progressive neurodegenerative disorder affecting movement. 56. What is multiple sclerosis? Autoimmune demyelinating disease of CNS. 57. What is cerebral palsy? Non progressive motor disorder due to brain injury. What is ataxia? Lack of coordination. What is spasticity? Velocity dependent increase in muscle tone. What is neuroplasticity? Brain's ability to recognize itself. And the seventh section is about cardiopulmonary physiotherapy. What is COPD? Chronic obstructive pulmonary disease. What is incentive spirometry? Device used to improve lung expansion. 63. What is postural drainage? Positioning technique to remove secretion. What is chest percussion? Rhythmic clapping to loosen mucus. 65. What is pursed breathing? Breathing technique to improve ventilation. 66. What is diaphragmatic breathing? Breathing using the diaphragm efficiently. 67. What is pulmonary rehabilitation? Compressive treatment for chronic lung disease. 68. What is cardiac rehabilitation? Exercise and education after cardiac events. 69. Normal blood pressure around 120 by 80 mmHg. What is oxygen saturation? Percentage of oxygen bound to hemoglobin. Next, move on to the next section, rehabilitation. 71. What is gait? Pattern of walking. 72. What is gait cycle? Sequence of events during walking. 73. What is stance phase? Foot in contact with ground. 74. What is swing phase? Foot moving through air. 75. What is balance? Ability to maintain body's center of gravity. 76. What is proprioception? Sense of body position and movement. 77. What is rehabilitation? Process of restoring function and independence. 78. What is ADL? Activities of daily living. 79. What is disability? Limitation in performing activities. 80. What is handicap? Social disadvantage due to impairment. Next section is about clinical and assessment. 81. What is palpation? Examination using touch. 82. What is inspection? Visual examination of the patient. 83. What is muscle tone? Resistance to passive movement. 84. What is muscle strength grading? MMT scale from 0 to 5. 85. What does grade 5 muscle power mean? Normal strength. 86. What is pain? Unpleasant sensory and emotional experience. 87. What is VAS? Visual analog scale for pain assessment. 88. What is edema? Swelling due to fluid accumulation. 89. What is inflammation? Body's response to injury. 90. Cardinal signs of inflammation: redness, heat, swelling, pain, loss of function. And the last segment, the common interview questions. 91. What is the RICE protocol? Rest, ice, compression, elevation. 92. What is PRICE protocol? Protection, rest, ice, compression, elevation. 93. What is evidence based practice? Clinical decisions based on the best available evidence. 94. What is informed consent? Patient's voluntary agreement to treatment. 95. Why is documentation important? Legal, clinical, and communication purposes.